Hi, I'm Dr. Vipul Shah, Clinical Health Director here at PAC Health. We're here in the PAC Health studio for our weekly update on COVID-19. This week, we've seen the number of confirmed cases in the US continue to climb, which makes it ever more important to double down on your efforts to protect yourself and others. We know that many of you have chronic conditions, so today we're going to take a closer look at the precautions you can take. We'll go over diabetes, cancer, heart disease, and chronic lung disease. But these recommendations can apply to other conditions as well. The first point is that no matter your health status, washing your hands is still extremely important, as is social distancing and following the guidelines from your local health departments. You can also help protect yourself by eating right and making time to be active. Let's start with diabetes. As always, it's important that you maintain good glucose control. That means following the instructions that you have from your doctor and utilizing your health advisor if you need any extra help. Other things you need to do are make sure that you're taking your medications, things that you're taking for heart disease or kidney disease that go along with diabetes. Staying active and eating healthy are very important as well. Finally, if you do develop any symptoms of COVID-19, call your doctor and have a log of what your glucose readings are. Get immediate medical attention if you experience severe symptoms such as difficulty breathing, extreme shortness of breath, persistent pain or pressure in your chest, confusion, or bluish lips or face. Let's move on to cancer. If you're undergoing current therapy, it's very important right now that you maintain social distancing and try to stay home as much as possible. It's also important that if you're taking medications that you have at least a 1-month supply on hand, and if your doctor recommends it, getting a couple months extra as well. Have an emergency contact list, and if necessary, create an emergency plan in case you do get sick. Finally, if you are experiencing any symptoms of COVID-19, once again, fever, cough, or shortness of breath, make sure you talk to your provider as soon as possible, as this could be a sign of an early infection, not just COVID-19. In terms of heart disease, some of the same things apply. Stay up to date with your vaccinations for the flu and pneumonia. Keep taking your medications. You may have heard some stuff about ARBs, or also called angiotensin receptor blockers, or ACE inhibitors. It's important that you at least talk to your doctor before changing that regimen. If you haven't heard to stop them, continue to take them as prescribed. Finally, let's talk about chronic lung disease, specifically asthma or COPD. If you're taking inhalers for your asthma or COPD, make sure you're taking those as prescribed and that you have enough of those medications on hand. And if you develop any symptoms of shortness of breath, make sure you call your doctor. As with all of these conditions, and even if you don't have a chronic health condition, managing stress and anxiety is also very important during this time. If you need any tips on how to help manage that, or just need someone to talk to, call your health advisor. Thanks again for joining us. Last week we took your questions and you can see that video at pachhealth.com. There are a lot of other great resources there as well. Remember that your health advisor is here to answer your questions, help manage your stress, and help you get things done, like have groceries or medications delivered. Just reach out to us. Be safe, and we'll see you next week.